Hey community, this is Dr. Hugh coming at you, and today I have a very powerful webinar that I put together, which is fluoroquinolone induced leaky brain, blood-brain barrier damage, neuroinflammation, nerve pain. A lot of people have been coming to me lately that have taken fluoroquinolone, Cipro, Levaquin, and have severe neurological problems, such as dysautonomia, racing heart, anxiety, panic attacks, blurred vision, uh, just an array of severe neurological conditions. And I want to kind of go over really what's the root cause of these things and what can actually be done for you to get better. So, what today's webinar is going to be about, it's going to be about going over how these class of antibiotics, how they affect you. So it's not going to be going over protocols or anything like that. I've got tons of content on my website about this. This is strictly the pharmacokinetics, basically a big word for meaning how this actually gets in your body and how it actually affects you. And if you have any neurological problems at all, you need to watch this video fully so you fully understand what's happening with your body. And the good news is, once you understand what's happening with your body, you can get well. You can start to recover from these medications. So what we're going to go over is these fluoroquinolone toxicities. They have basically three really important properties that they have together. So I'm going to go over these three properties, and these three properties are the main reason why people are suffering from these antibiotics. So the first property right here is it easily enters the tissues, especially fat tissues. All right, so this is one thing that you really want to pay attention to is these medications, because they have the fluoride, love fat. They can penetrate fat very, very easily. And guess what? This is your neurological tissue. Your neurological tissue is completely all fat. Now, when we talk about neurological tissue, we're talking about your brain, your central nervous system, and your arms and your legs. All this is high dense tissue that is fat. So the first property right here is it easily penetrates the brain. And this kind of here, this thing right here, it's a grease seeking. What does that mean? That really means that these class of medications love fat. It's like grease seeking. Like if you put grease on your hands, it slips right in. That's the first property. Second property is it specifically targets the DNA in the bacteria. So this is a very specifically unique property of these fluoroquinolones. And you can see right here, this is the drug right there. It's tearing apart the bacterial DNA. It's tearing apart the DNA. Now, here's the problem with that, is when God designed us, he designed the bacterial DNA and our God-given mitochondria DNA to be virtually identical. So these class of medications do not know the difference between bacteria DNA and your mitochondria DNA. So what happens? You are going to get damaged. It's going to affect your mitochondria. And check this out. This is a crazy statistic. Is each cell, we have about 30 trillion cells. Like that's a lot of cells. Each cell can have between 500 and 2,000 mitochondria. Between 500 and 2,000 mitochondria. So this is why when people take these medications, some people get damaged and they have an array of different symptoms. A lot of things are neurological based because it literally destroys your mitochondria. That's the second thing. And it gets confused. It doesn't know if we're going over the bacteria DNA or if we're actually affecting the human DNA, which causes tons and tons of side effects. Then the second property here, which makes this very, very unique, besides all the other class of antibiotics, is it has this fluoride. Now, fluoride gives this antibiotic very, very unique properties that no other class of antibiotics possess. And this fluoride molecule, this is what's causing the black label boxes. It's the powerhouse of these antibiotics is the fluoride in the drug right there. Okay, so I'm going to take you back way, way, way back to elementary school, and we're going to go over this, basically the periodic table. Now, what you're going to see is over here is you are going to see fluoride right there. Okay, you see that F? That's on the top of the periodic table. And then all the way down here, we see that I-53, that's iodine. And you can see that's substantially down on the periodic table. Now, why does this matter? This matters is because when we're up on the top of this periodic table, these elements are very small versus these elements down in here, like iodine, is very large. So the closer you are to the top, the smaller the actual molecule is. So the closer you are up to the elemental table, the beginning, the smaller that little element is going to be. Now, why is that such a big deal? Is check this out here. We're going to have fluoride right here versus iodine right in here. So we have fluoride, so it's small and it's very aggressive. Versus iodine, it's large. In fact, iodine is 3 times the size. And iodine is kind of like, it just kind of hangs out. It's larger, it's more stable. So anytime we talk about molecules and molecule structure, the smaller it is, the tighter it is, the more potential that is to cause harm. And this is why really the devastating effects are of these medications, because specifically of the fluoride molecule. And it all gets down to how God designed us, how God designed these elements. Right in here is the fluorides at the top, and then the iodine is way down, 3 down lower. Now, as you know, is these antibiotics they're going to cause massive amount of leaky gut. Now, when God designed this, he designed our gut and our brain to be identical in structure. So if you have a leaky gut, you have a leaky brain. And these antibiotics are the atomic bomb of antibiotics. And what they do to the gut is here, let me go over what a normal gut should be. This is a normal, healthy gut right here. This is critical. You're going to see this saliva layer right here. This is the mucus. This is very, very critical. This is super, super important. You can see here that mucus layer right in there. That would be kind of like your tongue. Like if you stick out your tongue and there's mucus on it, that's a protective barrier. Now, if you have dry tongue, you know how uncomfortable that is. So this barrier right here is very critical. And then we have this right here, these individual cells. And then we have these tight junctions right in here that prevent things from getting into your bloodstream, which is right in here. Now, we have leaky gut right here. So if you've taken these antibiotics and you have some kind of side effect, if it's neurological, or if it's gut, if it's musculoskeletal, if it's tendon, you have some degree of leaky gut. And if you have some degree of leaky gut, you have some degree of leaky brain. Now in here, look at this. This is leaky gut option right in here. You can see what's happened to the mucus. What's the first thing you notice to that mucus layer? What's happened to it? The mucus layer is completely gone. Your gut has dry tongue, very dry tongue. Now, when that happens, just like if you have chapped lips, like you get chapped lips, you get these sores right over here. When you get these sores, that's when the bad bacteria, toxins, can get into your bloodstream. You have gluten here, it gets into your bloodstream, and that causes inflammation. Then you can see here how these cells are not healthy, right? And you see these little things right up in here, these little finger-like structures in here. So what that is here, this is called, they're the bush border. Okay, so they're just like little fingers, and then food comes in here and starts to digest it. And what happens is when you get leaky gut, it's not a very good picture right here, but these little fingers start to get irritated and they get a lot shorter. So that's what happens when it comes to your gut. Now here's just another visual here. We're looking at the gut right in here. This is the stomach. You can see right in here, all this stuff here is 1 cell thick, right? So this is 1 cell thick in here. So we have 1 cell thick in here. And then you can see down here we have leaky gut as well. And then down here, this is the blood-brain barrier. You can see this is 1 cell thick. And then down here, this starts to break up. This is leaky gut. This is when a whole bunch of these particles can get in your brain. And when they get into your brain, guess what? You have neural inflammation. You have your brain that's inflamed, and you can have any weird neurological condition that's non-explained. So if you go to the doctor, neurologist, and you have these weird neurological symptoms, and they don't know what's going on, they say it's all in their head, it's crazy, there's no way this medication can cause that. That's not true. Okay, you have neural inflammation, you have leaky brain, and you have to handle your brain inflammation, which guess what? Can be done through a very specific functional medicine program. Now, I've created this webinar here to be really quite visual, but there's a couple terms I just want to go over so we're all on the same page so you can get the maximum benefit out of this. So one of the things that happens, there's this thing here called the circumventricular organs, or the CVOs, the ventricle organs. So what are they? They are indeed highly specialized leaky spots in the brain where the blood-brain barrier is intentionally absent or modified to allow vital communication between the blood and the brain. Permeability. So what happens here is, unlike typical capillaries, the CVOs, which are these things right here, the circumventricular organs, CVOs, capillaries, are fenestrated. Well, what does fenestrated mean? That just means they have holes in them like your finger. So they're not tight. They're not like tight junctions, right? Like when we're talking about, this is in your brain. This is your blood-brain barrier. So you have these tight junctions like this. And then some areas you have the CVOs, and they're fenestrated like that to allow molecules to get into your brain. Okay? So this is very, very critical. So here's a great visual. So circumventricular organs, CVOs, are leaky. So what is this saying? This is saying that when God designed us, he has certain areas in our brain that are already leaking. Now, why would that be? Because when we eat food, our brain has to sense that, and it has to see what's in our blood. What's our glucose levels? What's our inflammation? Do we have bacteria? Do we have viruses in there? What's going on in there? So God created very, very specific areas of our brain that are leaking. So this is a great visual. So this right here is the normal. This is the normal blood-brain barrier. So what we're going to see here is this right here is the blood-brain barrier. You can see these cells are very, very tight, right? So we're looking at something like in this picture right here, very, very tight. Now we're going over to your brain right now, right? So this is your brain. So these would be the tight junctions right here. So normal blood-brain barrier. The blood-brain barrier is tight and sealed to protect the brain. That's how you want it. Now we have the CVOs, the circumventricular organs. You can see this right here. This is a really cool diagram. You can see here, this right here is the tight junction right there. You see that? That's the tight junction. That's the tight junction. But between these tight junctions, there's a CVO, which is the opening, right? We need to sense what's in our external environment. So this is the brain right in here, right? So this is the food. This would be the bloodstream right in here. So it helps regulate hormones, fluids, blood pressure, and it's small, and it basically, it's a regulated opening right in here, the CVO. So this is critical. So what happens in here? You get water comes in, hormones come in, and toxins come in. So just think of it. This is pretty amazing the way God designed our brain. It already has areas that are leaking, so we can get food and nutrition and ions in and out of the brain, and we can see what's happening with our body. Now, here's what happens when you have leaky brain or your brain is damaged. What happens to the window, the CVO? It's completely torn apart. Bam! Bam! Things get in there. Things get in there and cause neuroinflammation. So cells are pulled apart, uncontrolled openings, inflammation and sensitivity. This is crazy what happens. Inflammation from antibiotic injury can stimulate the CVOs and damage the blood-brain barrier. So I want to talk about a couple things right here. So in God designed us, you have the blood-brain barrier, and then in certain areas of your brain, you have the CVOs, which are basically openings in your brain, just like a screen on your door. Okay, envision these CVOs as screen doors. They're screen doors in your brain. So here we have the tight junction, right? Healthy tight junction. And then between some of these tight junctions, we have a screen door, which just allows things to get in and out of your brain very easily, because we need to be sensing, your immune system needs to be sensing what's happening in your blood and in your immune system and in your lymphatic system 24 hours a day, every single second of your life. Now in here, so these act as a screen door, the circumventricular organs. It's naturally leaky areas of the blood-brain barrier designed to allow small molecules in the bloodstream to pass to tiny fenestrations, which just means like a fence. And this here, let's blow this up. You can see that right in here. This is coming in here. This is the screen door. These are all the elements in there. We have water, hormones, ions, and of course we have toxins in there. So some things are going to get through and some things are not. So this is a pretty amazing system when you think about how God designed it. Is he designed our brain already with areas that are leaking. Now, here's what happens. is when you take these antibiotics, it destroys the tight junctions here, and it destroys, guess what? It destroys your screen doors. So the circumventricular organs right in here, this is normal, healthy, nice and controlled environment. And then what happens over here? What happens to the screen door? Bam! That thing blasts open from the antibiotics. And now what's going to happen is you have all these things from your bloodstream going into your brain. If you've taken these antibiotics, they're in your bloodstream. They've like ripped the screen doors, direct access to your brain, neural inflammation, dysautonomia, POTS, increased heart rate, increased blood pressure, temperature control, weird thoughts, anxiety, panic attacks, blah, 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 blah. All the neurological things happen because these class of drugs love fat, right? They're attracted to the brain because the brain is highly, highly fat. So large holes, uncontrolled openings are in here, large holes in the screen. Everything gets through, including bacteria, inflammation, molecules, and let's say let's say you have a mold case, let's say you've had mold for 20 years, had no problem. You take these antibiotics, it causes leaky gut, leaky brain, not only with the tight junctions, but with the screen doors. Boom, they get blasted. The mold is in your body. The mold goes to your brain. You get neuroinflammation. Mold does not like antibiotics. That's what I've seen clinically. If people have mold from 20 years ago, they take these antibiotics. The antibiotics wake the mold up. The mold sees the antibiotics and say, "You're trying to kill me? Nuh-uh. I'm going to start producing my poisons," right? So when they start to produce their poisons, this is when people become very toxic. Now, this is a really critical part right here, is where in particular are these CVOs found? So there's very specific areas in our brain that the CVOs are located. So let me just go over this again. Most of your brain is this tight junctions, right? The tight junctions. Then there's very small areas in your brain that have the screens, right? The screen doors. Those are the CVOs. Now, those are strategically placed in certain areas of our body, and guess what? They're located deep inside the brain, inside in your brain, where your sympathetic nervous system is and your parasympathetic. Those are fancy words for that's where all the regulation of your nervous system is deep into your brain, right? Because we want to make sure our heart works. We want to make sure that we're breathing. These are very core mechanisms that are deep into our brainstem that we really need to protect and make sure they're not damaged. So the first one here is found in your hypothalamus. Well, where the heck is your hypothalamus? You can see right here, here's the hypothalamus. See, that's like really deep. It's really deep into your brain to get you oriented right here. This would be your chin right in here, right? So this is the chin, this is the head right here. This would be the eyeball like sitting right in here. That would be the mouth, right? Okay, so it's the hypothalamus has a bunch of these fences, right? Screen doors, right? They have screen doors all over the hypothalamus. What does the hypothalamus do? Check this out. It regulates your temperature. It helps you sleep. It helps appetite. It regulates hormones. It regulates mood, anxiety, depression, irritability, memory issues. It helps vision, and it helps to do with thirst. Now, why is it? Because these things that we just went over here are primitive, like you have to have these things, and they're deep inside of your brain, neurological tissue. This is why God designed us, these screen doors. We want to taste the environment. So that's one place that it's found. The second place that it's found in your thalamus, right in here. Well, where's your thalamus? Your thalamus is right in here, right? So we have your hypo, which means lower, hypothalamus right in here. Hypothalamus, and then we have the thalamus, which is right in here. Well, what does the thalamus do? What does that control? That controls sensation, vision, hearing, motion, right? Ataxia. Ataxia just means like you're off balance. You can't balance. A lot of people that have been hurt by antibiotics, they have gait problems. They have shaking hands. Their eyes cannot track properly. All this is done here through the thalamus as a major relay center deep into your brainstem, right up in there. But it needs to know what's going on in the environment, so it has the screen doors where it can sample what's happening in your body. It also helps sleep, cognitive issues, language deficits, basically people feel like they have brain fog, brain fatigue, vision problems, behavioral changes. So you can see here that this is really critical, that if you have these antibiotics and it affects the screen doors, so now what happens is you're going to have big screen doors right here in your CVOs, right? The CVOs right here, big screen doors in the circumventricular organs. Things get in, and then all of a sudden you have a neuroinflammation case, and you have weird neurological conditions that no one can explain. And what the heck's going on? Problems after problems after problems after problems. Okay. That's one concept. Another concept is this. You got to stay with me on this. There's a calculation. It's called log P. Very simply, what log P is. Every drug has this calculation. It calculates, is this drug fat loving? Does it love fat, or does it like water? Because when we look at our body really is water and it's fat. That's how God designed our body. So this, what they call a P log, determines if a drug likes fat, or if a drug likes water, or if it would be such as like neutral. Okay, so really simply here, what is the P log? Think of it as a passport. Okay, think of it as a passport. I love this analogy. So the P log is a passport. So if you have a passport, you have direct access, boom, right through, go right past, go into the brain. So you have a high P log, or log P. So a high log P tells you it's a passport. You have direct access, boom, right into the fat, which is right into the brain. So a log P acts as a passport that tells the drug or nutrition how easy it can move through the different environments of the body. The body is essentially made of two things, water and fat, right? That's pretty much it. So water loving is a low log P, okay? So just remember, passport. So if you have a passport, you have a high log P, which means it goes into the fat tissue. So water is low P, it has low P, there's no passport. These molecules stay in the bloodstream and move around easily in the watery parts of the body, but they struggle to get into the cells. Okay, low log P, no passport, okay? High log P, direct passport into the brain, into the fat tissues. This is not good, right? This is not good. So high P, right? High P, passport, high P is fat loving. These molecules are greasy. They can easily slip through the fatty walls of the cell membrane and reach deeper tissues like the brain. Okay, so guess what? Do fluoroquinolones, the class of medications, have a low log P, right? Low, or do they have a high log P? Guess what? They have a high log P. It means they love fat. Okay, so check this out right here. So this is the log right here. Okay. So zero would be neutral. Zero is neutral. So check this out. We have ciprofloxacin, which is 0.28, right? So that's positive. That's positive. We have Levaquin, which is 0.5. So here, when this talks about how it likes the fat, right? So ciprofloxacin is moderately attracted to fat. Levofloxacin is moderate to high attracted to fat. Moxifloxacin is very high. This is the worst one right here. Okay. Now you can see this. All these have positive p-values. They all have the passport. They all have a positive number passport directly into the brain and causing all the things that we just talked about in these other slides. The neuroinflammation, the screen doors get blasted, and you have chronic systemic brain inflammation. Now check this out. I put this in here just so a comparison. So amoxicillin, this is negative. So if it's negative, there is no P for passport. So it doesn't get in, it's water, and it does not penetrate the blood-brain barrier. So that's pretty incredible. So if you have a log P that's positive in the positive area, it loves fat, it loves to get into the brain and cause its damage. So here's another great graphic right here. So understanding log P. So this is really, really simple, right? So right here, this is water soluble. Right here, the blue stands for water, right? So this is going to have a low value right down here, a low value right in here. So these ones are water soluble. They stay in the bloodstream. Guess what can clear them? Your kidneys can clear them. Guess what happens? Your kidneys clear water, right? So a low P, amoxicillin, has a negative number. It stays in the bloodstream. Your kidneys filter it out. Very easy. But guess what happens over here? Oh, hang on. Poor penetration into the brain, right? Poor penetration into the brain. And these are water soluble drugs. Now, let's say here we have a high log P. Let's say we're going to be taking, let's say right here, Levaquin. So we have a 0.5 log. So it's higher. So it gets deep into the tissues. It's stored in fat. Higher risk of symptoms, especially GABA right here. That's like your relax, deep penetration of the brain. And these drugs like fat. Now, guess what happens? If they like fat and your kidney filters out water, it can't filter out your kidneys because it's fat loving, right? So these are all the things where it gets penetrated into the tissues and causes problems deep into the tissue. And one thing you need to know about, for example, the cell membrane and the mitochondria, that membrane is all fat. Like your mitochondria, 500 to 2,000 mitochondria in each cell. The cell membrane, the mitochondrial cell membrane is fat. The cell, now we're talking the cell membrane is fat. So the cell membrane and the mitochondrial membrane, they're all fat. These drugs love fat. And they have that fluoride, remember the fluoride molecule, which is very, very teeny and small. Boom, pops right in there, causes damage, right? So I'm hoping this is making sense to you. This is just another great graphic. This is the p-value. So we have p-value here of ciprofloxacin, which is 0.28, levofloxacin, which is 0.5, and then we have the strongest one, moxifloxacin, which is 1.45. So as you start to go up this way here, as you go from here to here, obviously the p-value is higher. The p-value is higher. The p-value is higher. So when you go to these other different medications, the absorbability into the fat is higher. Now, I'm just going to give you a case because I see this hundreds and thousands of times. So if someone already has, let's say someone already has a gut problem, like they've had constipation, diarrhea, you should have normal bowel movements, 2 to 3 bowel movements every single day, no gas, no bloating, no diarrhea. Okay? 2 to 3 bowel movements every single day, no gas, no diarrhea, no bloating. You're not taking any kind of medication, right? That's normal. So let's say someone already had a problem. Let's say they're making a bowel movement once every 2 days. Once every 3 days, they had gas, they had bloating to start with. So their gut is already leaking. They already have a bad gut to start with. If you have a bad gut to start with, there's a probability that you already have a bad blood-brain barrier. So these people that don't go to the bathroom on a regular basis, just saying prior to getting damaged, just hypothetically. Maybe they have brain fog, brain fatigue. Maybe they don't think they're sharp as they were. Now they take this medication for whatever reason, and now their gut gets really worse. So their gut's more leaking. Their brain becomes more leaking. And when your gut becomes more leaking, more molecules, more gluten, more bacteria. If you have small bacterial overgrowth, can get in your bloodstream. That causes inflammation. That goes to your brain. Your brain is open out. So those tight junctions, like here, remember those tight junctions should be like this. Now they're broken, they're leaking, and what happens to the screens? The screen doors in the brain, boom, they're blasted open. So you can really see what's happening now from a spectrum of neuroinflammation when people get damaged, and this is why people, I don't know, it's just tragic that this is what's happening. So this is just kind of some simple math. So if I have a log p-value of 1. For example, a log p-value of 1 means that it's 10 times more concentrated in oil than it is in water. So if I have a p-value of 1, right, it's 10 times more concentrated in the fat than it is in the water. So let's go up to this right here. So in here, this right here, so if this is, I'm just going to take levofloxacin. This right here is a 0.5 value. Okay, so here if it was 1, it's 10. So this is 5 times more likely or 5 times more fat loving than water. So levofloxacin loves fat 5 times greater than it does water. That's what these calculations are actually showing and demonstrating here what's going on in your brain. Now, let me bring you to this because I want to make some things, some points clear. Okay, if anyone has heard of a Z-Pak, what's a Z-Pak? That's an antibiotic. That's the name of it right there, the Z-Pak. Now, the Z-Pak has a log P of 0.48, right? 0.48. And then we hear Levaquin has a basically a log P of 0.50. So you can see this right here, boom, and this right here. When it comes to the number of the log P, they're pretty much identical. Okay, we're going to just say both of them are 0.5, 0.5, 0.5 and 0.5. Now the Z-Pak, why don't people have problems on the Z-Pak like they have with the fluoroquinolone toxicity? And it comes down to what? It comes down specifically to this. They are chemically distinct. And what makes this thing chemically distinct is you have it right here, fluoride. So fluoride is what's making these class of medications so dangerous, is the fluoride molecule. So you can have the two numbers of the P log of 50 and 50, but the fluoroquinolones are going to be way worse because it has a fluoride, and the fluoride can penetrate deep into the brain tissue and cause neuroinflammation. Not only the brain tissue, but we're talking you also have your nerves in your hands and your feet. That's also neurological tissue as well. So that can be a problem as well. So in here, I just like this kind of summary right here, the comparisons. So ciprofloxacin right here, moderate tissue disruption, moderate central nervous system risk. Levofloxacin 0.50, high risk, significant tissue saturation, frequent brain fog. And moxifloxacin, very high, deep penetration, high risk of psychiatric side effects. Okay, that's pretty scary, right? So this stuff gets deep into the tissue and it moves very, very quickly. All right, so here I want to talk about these two different medications here. So we have fluoroquinolones right here, and then we have amoxicillin. Now, before I go on to this, let me just show you this graph right in here. Okay, so right in here, you can see this right here. This is the p-value, right? The p-value of amoxicillin is right in here, negative 0.06. So what if it's negative? If it's negative, what do we know right away? We already know that it's fat loving, okay? And then we have these down in here, which we already went over these, is the 28, 50, and 1.54. Now, this is what I like about this. So this right in here, this is going to be the blood-brain barrier. That's a blood-brain barrier. It could also be your screen doors as well. Now, because of fluorine, see this? It gets in. It gets in. Why does fluorine gets in? Because it's very small molecule. One of the properties, it's very small, fat-loving. It blasts in your brain, and you can see what's happening in here. This is all neuroinflammation happening right in here. So it's small, fast, and it penetrates versus amoxicillin, which again is water-soluble, very poor penetration. It's kind of like a cotton ball. These are a cotton ball. The cotton ball comes in and bounces off, and you are out, and your brain is saved. So they are large, slow, and does not penetrate, and it stays out. The amoxicillin, which have a negative p-value. So they like water. Here's another example. Amoxicillin, same thing. You see this 0.06, right? Negative. You see that's negative, negative. It loves water, right? So it's cleared by what? It's cleared by your kidneys. Super out, bang. Stays outside the fatty tissue, avoids deep penetration, low risk for CNS risk. And in here, same thing here. These W's right here just stand for water. This is amoxicillin. It hits the blood-brain barrier and bounces off, right? So completely different mechanisms. So I'm hoping now you can see like, OMG, what's happening and why you're having all these different symptoms when it comes to these class of medications. Here's just another visual. I'm a huge learner of visual. You can see here, this is the p-value down in here. So it's low. And then as we move up, high p-value in here. So it's cleared by the kidney, stays in the blood, water soluble, poor penetration in your body here. It loves fat, deep penetration into the tissues, deep penetration in the brain, higher risk of symptoms, more fat loving. Anytime we talk about these medications down in here, right in here, they move up on the higher p-value. Okay, so let's summarize this up. There's really three properties that this class of medication possess that make them so deadly and dangerous, and why people have so many side effects. First thing is right here, high p-value. Like we went over that multiple times. Second thing here in here that we touched is these medications go after the DNA of the bacteria. This is the only class of drugs that go after the DNA of the bacteria. Some bacteria will go over the cell wall, right? It will poke holes in the cell wall. Some other antibiotics will go over like the metabolism of the bacteria, but this specifically targets the DNA, and it does a great job of that. It targets the normal bacteria DNA. It unzips them, and so they basically they are going to stop replicating. Boom, stop replicating. This is the thing. When we kill bacteria, it stops replicating. And guess what here? The bacteria get torn up. But this is the consequence right in here, all the bad stuff. So it also affects the energy cells, the mitochondria right in here. So it actually has the bacterial DNA. So it's going to stop this. It's going to stop the replication in the DNA, stops the DNA right in here. And then what happens is then you get sick mitochondria. And as you know, mitochondria are the driving force of everything in your entire body. It's just not for healing. That's just a little small bit of what these mitochondria do. They're really driving everything in your entire body is to make things work. The third thing that we want to worry about here is the fluoride. And the fluoride makes it very penetrable deep into the tissue. So this is just an example of a negative p-value, negative 50. This is just an example again, okay? Water-soluble p-value. Water-soluble, it easily washes out of the body. So I just want you to see that? It's negative 50 right in here, negative 50. Okay, now we're going to the fluoroquinolones. You have the fluoride. This is just an infographic in here. It's just using an analogy of plus 50 right here. So when that happens right here, it's not cleared by the kidneys. It stays in the bloodstream. It stays in the bloodstream because the kidneys only filter out water-soluble products, right? So this is a fat-soluble product. So what happens here, it starts to accumulate in your central nervous system. It affects the DNA because the mitochondria, because that's the DNA in there, mitochondrial DNA dysfunction. It's greasy. Remember, it's greasy. This is the thing that the fluoroquinolones have. It's greasy. It penetrates very easily. It's hard to get out. And then you have all these different symptoms, low energy, brain fog, nerve problems, whatever. The symptoms go on and on and on, and they're really endless of the symptoms that people can actually experience. And remember here, the biggest quality right here is the fluoride. The fluoride molecule right here is 3 times smaller. 3 times smaller. This is actually the size right there, 42. It must be a range 115 to 140. So the fluoride molecule is literally 3 times smaller than iodine. And you know how important iodine is for the function of your thyroid. That's very, very, very critical. So this is it. If you're out there looking for help, you don't need to suffer. There's lots of help out there. I help people all over the United States to get better through telemedicine. And if you're interested, you want some help, just go to my website right in here, drhughwegwerth.com. Come up in here, right here. Click this button right there and schedule a Zoom call. And we can chat and actually figure out exactly how we can get you better. And remember this. Oh, one last thing here. All this stuff is referenced. Everything is referenced here. It's references, also references on the pages as well. If you want the references, you have to go to my website, right? This might be on YouTube. You go to my website and I'll have all the references there. So remember this. Where there's help, there's hope. Where there is help, there's hope. Take care. Bye-bye.